going to see a lot of sail. Anybody else sailors in here today? Good. So that'll help a lot. Good. Thank you. And I'm a dentist. I keep seeing a couple of places that list me as an MD, but I'm a DDS, so don't cover your mouths and hide from me when you meet me, because that's what a lot of people do when they hear I'm a dentist. So today I want to talk about dentistry and teledentistry and how coming to this way was a perfect storm for me as a dentist in my profession. And the definition of a perfect storm is an unusual combination of events or things that produce an unusually powerful result. So as sailors, everyone has heard the old adage, red sky in the morning, sailor's warning. And in healthcare, I believe we have a lot of warning signs that the storms are coming and the storms have moved in, and our healthcare system is being really challenged right now. In the movie The Perfect Storm, which is based on a true story, George Clooney and Mark Wahlberg are confronted by three storms that collide and actually produce the most dramatic storm in history of the United States. So they went out in their ship in spite of warning, in spite of the red sun in the morning, and they set sail, and the results ended up being disastrous because they didn't listen to their warning signs. Fortunately, teledentistry is an innovation challenging healthcare tale, not a harrowing tale of man against nature saga that ends up with the boat capsizing and all aboard dying. However, again, using nautical terms, we need to trim the sails of healthcare costs and apply proven research methods to improve oral health care and improve patient outcomes. Our healthcare system is capsizing, and we are losing lots of patients. And as a dentist, I believe we can address a lot of the issues by improving oral health. It's not moving forward. There we go. So the perfect storm for teledentistry. Monte Driver, I'm stuck. Harry. I'll tell the story of Monte Driver while they try and figure out why that's not coming in. Monte Driver, 12 years old, died of an abscessed tooth, and the media will tell you that he died from a tooth infection. However, Monte went to 2 emergency rooms with a complaining of a headache, never saw a dental consult, and in the 3rd emergency room, they admitted him to the children's hospital saying he had meningitis. This young man actually had 2 emergency brain surgeries to relieve the pressure on his brain. At the 2nd surgery, they removed the infected tooth, which was the source of the infection, and 6 weeks later, for lack of an $80 tooth extraction, Monte Driver died. He had hundreds of thousands of dollars of medical care provided to him, except a dental consult. So Monte Driver was one of the first winds blowing saying something needed to be done about health care. Then in 2014, the American Dental Association came out that $1.7 billion was spent in emergency rooms on toothache codes alone. And nothing is done. There's no treatment done. The expenses we know for emergency rooms is extremely high, and the patient's sent off to go find a dentist. And wherever you all are from, if you call tomorrow a dentist that you're not a patient of record, they will say, generally the front desk people say, we can see you in 6 weeks for a new patient exam, and there just aren't very many toothaches that can wait 6 weeks for a new patient exam. Historically or statistically, those patients 20% of the time end up back in the emergency room for another expensive emergency room visit because they never had a dental visit. Again, research shows that we can reduce the cost of health care by 17% by integrating oral health. It's funny listening to the previous speaker, 17% comes, 17, the number comes over and over again. So 17% by integrating oral health. And again, the call for oral health to be integrated into primary care by the Surgeon General, the Academy of Pediatrics, and the Academy of Family Practitioners is echoing. And then telehealth technology. So I'm sitting at a table with really smart people, hearing all this information and going, and they were all doing telemedicine, and it was like, that's what we need. We need a virtual dentist to provide the care. So the storm clouds have been brewing. When 39% of the population did not see a dentist, it's an average of 3 years for most people to get into a dental appointment. 125 million people today need dental help. There's a huge gap in our system. Again, so a lot of them go to the ER for care, and 4% of emergency rooms in ERs, 5.5 million were for oral-related conditions. Now, if someone comes into the emergency room with a broken arm, they don't call in the cardiologist. So now they have the opportunity, if somebody comes in with a toothache, to call a dentist, so we get the right specialist in. Again, if we can disrupt the cycle of $1.7 billion of our healthcare dollars being spent on treatment that's not provided, and get those patients, some of those patients, into dental care and alleviated, then we can save a lot of healthcare dollars. Another crisis is 750,000 people will get sepsis this year, and 250,000 people will die. Again, there's research that have shown toothbrushing monitoring programs in hospitals, and the statistics are on here. And in this one case, they prevented 117 cases of hospital-acquired pneumonia. And if you save the patients' lives, save the cost of readmits, that program and that study alone saved $4 million in costs by by simply toothbrushing, a piece of plastic applied to the teeth. And we trained staff on how to do the toothbrushing. We have a QR code program that actually gets beeped when the patient's teeth are brushed, and the importance of toothbrushing, and those kind of statistics, saving lives and saving dollars and readmits, are very, very critical. Again, we've talked about a lot of healthcare, and as a dentist, I have to kind of stick to my speech or I'm really going to go off on a tangent, but it all begins at the mouth. The studies show over and over again, the research is out there, that oral health is related to osteopenia, premature and low birth weight babies, cardiovascular disease, diabetic patients, type 2 diabetic patients. You cannot improve A1C scores with gingivitis. Gingivitis is an infection, and we're not addressing the patient's oral health, and we need to make sure that that patient's A1Cs can't get under control. Heart disease, all these things are 100%, oral disease is 100% preventable. Everybody that didn't floss today, make sure to get up to your room. It is a bacterial disease. Proper brushing, flossing, and instructions can prevent almost all, now obviously not trauma, but oral disease, and it's a silent epidemic in America and around the world. It's the most contagious communicable disease in the world. It starts with a kiss. That kiss, those babies, they're not born with bacteria in their mouth, so we're spreading the disease, and it's the most common disease in the world. There are now techniques for reversing tooth decay, and we have to be able to get through teledentistry, get those techniques to patients that don't have access to care. And again, the healthcare industry has called to integrate oral health into primary care for years. We have $3 trillion in healthcare. If we can reduce the cost 17%, my phone calculator wouldn't carry all those numbers. I don't even know what that number is, but Aetna and Columbia University showed that they can actually improve patient outcome, reduce total health care costs, and you would think that in 2006 when this was done, by showing the drama of that, they worked on chronic diseases, they could reduce 20% lower risk scores, 12% lower medical costs for chronic patients, 25% lower preterm deliveries, and 34 fewer incidences of low birth weight. You would think those studies would mandate all payers require oral health or dental insurance be part of their package to reduce healthcare costs, but not yet. So we need to heed the storm warnings. We need to hear what's going on. Teledentistry can improve patient outcome. What you don't know can hurt you. Hospital-acquired pneumonias, aspiration pneumonias in nursing homes, where we're in nursing homes, is teledentistry as well. And this slide I'll do real quickly. This is, if you can't read it, you need to see the teleoptometrist. But this shows that teledentistry has been around since the since the telephone was first invented, and a patient could say, "Doc, my tooth is killing me." That's teledentistry. It's not new, just new techniques applied to it. And we are everywhere. Teledentistry can be used in all of these facilities. I'm getting the fast signs, so I won't go through them all because you all can read, but you can put a virtual dentist wherever, whenever a dentist is needed, 24 hours a day, to provide essential dental services for the patient, and the training for the staff and training for the doctors, and I'm done. so I'll leave a few minutes to ask some questions, and thank you.
Thank you so much. We have time for maybe one question.
Yeah, any aspiration to try to spread this internationally? I know that's the statistic of U.S. numbers, right? And that's other countries a lot worse.
Well, a lot worse, but it's tragic, the incidents we have here in the United States compared to no care in other countries. But absolutely, if I could fluoride varnish the world, I would. And being able to train other people how to apply fluoride varnish and reduce decay by 30 to 50% is one of our goals, U.S. and internationally as well. And there's decay stopping medication that can be put on teeth. We're going to train people to do those kinds of applications so we can actually impact oral disease around the world. And yes, that is, little goals, right?
Great. Maybe one last quick question.
So, you're right, absolutely right. We see this in hospitals. People have tooth decay and they come in with, sepsis. Question is, in those remote areas where there's no dentist, and most of the hospitals that are critical access, there is no dentist available on hospital staff. How do you see teledentistry?
Well, that's what we do. In the state, we'll have a dentist that may not be, that can be in a city, but can do teledentistry. That we consult with the patient, we do patient consultation, we get their medical history, their dental history, so we get all the patient information, and there's a video consultation with the patient and the dentist, and we palliate the patient's pain. We can do e-prescriptions, but we actually put dentists in those areas that there are not dentists. That's the goal, is to be able to have a dental specialist with all the programs and in all the areas that no dentists are currently available. And then our system actually takes it one more step, and we appoint them in a dental office. And in remote areas, it may be a 50-mile drive, but at least they know when they get there, they'll have an appointment waiting for them, so we actually appoint them. We don't say, go see a dentist. We take that step to put them in an office that's when they walk in, say, oh, you're here for your toothache, let's get you taken care of.
Thank you so much.
Thank you.